Good afternoon. Welcome to the first in a two-part series for Suicide Awareness and Prevention Week. My name is John Gregory. I'm the Community Care Director here at Samaritan Counseling Services of the Gulf Coast. And we want to take this opportunity this week to give you information to do exactly what the point of the week is, and that's help you be aware of things and also take steps in prevention of suicide. Helping us today is one of our registered mental health counseling interns, Sandy Poulos. Thank you, Sandy, for joining us today.
I appreciate you having me, John. Thank you.
Well, you've done a lot of work to prepare for this, and we're grateful for that and looking forward to what you have to share with us about statistics and susceptibility, warning signs, counseling, all of that stuff that we're going to cover in both of these sessions. So today, viewers, this is part one. And then this Saturday on September 10th, which is the actual Prevention Awareness Day, we'll have part two available for you. And we'll tell you more about that when we wrap up today. So I'm going to start sharing my screen here for us to look at some PowerPoint that we put together for you and give you some direction in where we're going in our thoughts today. In this section, we're going to talk about four main things after Sandy gives us an illustration of what it looks like to share our story. We're going to talk about statistics and susceptibility, and then warning signs, and then support that we can have in place when we know those risk factors and those warning signs. Before we jump into those things, though, we wanted to just share one brief thought for all of us that it really is important for us to share our story, whatever our mental health story is. This note here from the National Association of Mental Health Institute encourages us that sharing your story it's not only helpful to you and your journey, but it's a great way to show everyone around us that we're not alone and we're all walking a journey. And Sandy's brave enough today to do that for us and illustrate that for us about her and her family's story. So I'm going to put up these pictures, Sandy, of your family and your son. And if you will, go ahead and illustrate that. Tell us the story of your family.
Okay. You can see there are four of us in our family. I have two children, Max and Melina. Max is our oldest, and my story, and the reason I'm here today, is to talk about how we lost Max to suicide exactly 6 years ago today. Part of my healing journey has been to be able to share that story with others, and that's part of why I'm grateful to be here today. So he was a freshman at the University of Alabama. He had been there about 3 weeks when we got that dreaded middle of the night phone call that he had. Pretty unexpected. Can tell you more about that, but it was very difficult for our family to get through. It's been a long journey. So
6 years ago today, and it probably, I don't know, you tell us, what's that 6 years been like?
Well, the first year was a blur. The second year, kind of the numb wears off, and a lot of people say that about grief in general, that's when the pain and the recognition that this is forever, at least here on earth, begins to settle in. And people that maybe were there to support you so well in the early stages have gone back to their lives, to be expected, and your family is now facing the reality of the loss. So I would say by around year 3, I started to get some strength back in myself, and when I actually felt kind of called to go to graduate school and maybe study mental health and be more of an advocate for other people to recognize the signs and hopefully help other people not have to endure this painful journey. So,
well, I don't know that everybody who has walked your journey would be able to say that they got to that place of becoming an advocate. And so that says a lot about you and your family. And I'm going to guess it says a lot about your love for Max and what you want his story to be. Is that fair?
Absolutely. I mean, I definitely think it was more of an advocacy in a way for him. And in doing so, discovering how many other people either struggled or had been through something similar. So just being able to share our story and normalize it and know that we're not, it's been very helpful. But yes, everybody has their own journey. I've seen some really great stories of what people have done after they've been through something like this. And that's a whole other topic, post-traumatic growth. But yeah, it's, everybody has their own route through life, and this has been mine.
Well, thank you for sharing that. And all of us viewers, and of course, our team at Samaritan, we know this story. And so we're grateful that you have taken the steps you've had and you're where you are and you're willing to share this today. How about we jump into our thoughts about statistics and all of that. So let's come back to the screen here and look at a couple of statistics that if you're not aware of these, they may be shocking, and that's why we want to bring these to your attention. This first one regards gender, and I think this is really important, Sandy, as we look at this. When you look at this statistic about men and women, what does this say to you?
It tells me that women attempt more. They tend to use less lethal means. So it kind of, I mean, you see that men are four times more likely to die by suicide. It's kind of a jaded statistic because women are more likely to try. It's just that things like guns or other things that just are more lethal. Women might often use pills, or maybe they go in the garage and start the car or something and can be found in time. So it was also interesting that I didn't know a lot of these statistics till I started studying it after I lost my son, but middle-aged men are actually among the highest risk. So that was something to be aware of.
Yeah, it really is. Just looking at these, I'm a statistic person, so these things speak to me. They don't speak to everybody, but when you look at these numbers, it can be quite telling. And this one about cause of death statistics, that is the second leading cause of death for people ages 10 to 34, and the fourth leading cause, what you just mentioned about middle-aged, 35 to 54. That's pretty telling. At the bottom of this slide, though, maybe the most telling of the statistics about high school students. What does that mean for us?
It means that we really need to pay attention more than I think maybe we were used to in the past. There has been a 60% increase since 2007, and the first smartphone was released around 2006, 2007. So, but when I give presentations at schools and things, one of the things I talk about is the impact that social media has had on that generation that I don't think we as middle-aged parents were prepared for. And we don't know how to do it that well. So,
man, that's another presentation right there. The impact of social media on all of us, but particularly those, your student, like your kids. How old is your daughter?
Daughter is now 22.
Okay, so they've grown up with social media, right? And
Absolutely.
so they don't know a world outside of that. And the research is really coming in of, well, what does that mean for those kids and that generation that's growing up, and that's all they know, right?
We're exposed to a lot more if we allow them to be than I think their minds are prepared for. So unfortunately, there was that generation, my children's generation, where we as parents were learning how dangerous, things that you could shut off when you went home in the old days. You didn't have to see an X on social media, or things that maybe the bullying or whatever it is are now coming home with kids. So
that's right. Our final statistic you've already somewhat referenced this, but just the overall suicide rate increase in the last 20 years. To me, that sounds like a really ridiculously high number. Is that right?
It is pretty shocking, and that equates to about 130 people per day. So, I mean, it's pretty unbelievable to imagine that that's happening, but that's why we talk about it, so that people are aware.
Yeah, so viewers, those are a few statistics. Certainly, you could go to the NAMI site that you see referenced there on that slide, NAMI.org, and see plenty more statistics. But we want to move now into susceptibility. And what that means is, what are the risk factors? you're thinking about either the gender statistic or particular ages. All right, now let's move into what are those things that we can know even further that bring someone to being a little more at risk for suicide. This slide here just talks about that research has found that 46% of people who die by suicide had a known mental health condition. That doesn't mean, Sandy, I know you know this and you see this in clients, that doesn't mean that there's anything being done about that mental health condition. It's just, it's known that they have it, right?
Right. And even if something is being done about it, sometimes we'll talk more about that later, but sometimes it's just going to happen. And treatment of cancer doesn't always result in saving someone's life. So just like mental illness, there are different paths when all we can do is our best to try to help people if we're aware of them.
Right. So let's look at a list here of these risk factors, and this list could be much longer than what we have here, but we have 8 risk factors here, and we could talk another hour just about these. But Sandy, as you look at that list, which ones, I know they're all important, but which ones stand out to you?
Especially in the community of people that I work with, I would say the humiliation, defeat, and loss. So for a younger crowd, that can be a relationship breakup or just something that happens at school that's humiliating to them. Bullying, huge. I know we had some local terrible events happen recently with bullying and a young person taking their life. And unfortunately, that's all too common because young brains don't always see another way out. And then I would say trauma is another huge one. So if we can treat the trauma, sometimes we can reduce that desperation and that needing.
Yeah.
Gosh, so many of these. Probably a recent suicide. So we counsel people that maybe have had another family member or a close friend who took their life, and that definitely increases susceptibility in the short term. So getting that.
Yeah, and I can tell a quick story here. I, in my previous career, worked at a church where one family had 3 suicides within probably about a 5-year span.
Oh.
And it was different generations. It wasn't, one particular generation in that family. So because of that story, I know that that's a high risk factor.
Yeah, that brings up a good point. Family history of mental illness and family history of suicide can also be an increasing risk factor. So that's something we definitely want to explore.
Right. So that, again, viewers, that's a short list, a quick viewpoint of susceptibility and risk factors. And we want to move now, okay, if we know those things, that's good. Now, what are some warning signs that we can be on the lookout for? And I'm just going to say, if you're watching this and you hear one of these, it's probably time for action, but we'll get there in a minute. But the warning signs, this slide talks about particular comments or thoughts that you may hear, or you may be thinking yourself, like, I wish I wasn't here, or nothing matters. So these warning signs are very helpful for us. Here's another list here on this next slide. Sandy, if you could speak into each one of these, the importance of them, maybe the strength of this sign.
Yeah, definitely increased use of drugs and alcohol, because that can be a numbing agent where they're trying to reduce the pain. One of the things that my son was not using drugs and alcohol, but one of the things he left in his letter was just that internal pain. He referenced internal number of times, and I think just trying to escape that internal pain, a lot of people turn to those things. So if you see increased use of drugs and alcohol, that's one for sure. If they start to act recklessly, perhaps more than you're used to, seeing them becoming more aggressive, more impulsive, those are other warning signs if it's a change in behavior. And then social withdrawal. So if your loved one is spending more time alone, not wanting to do the things they used to do, just kind of laying on the couch or having a hard time getting out of bed, definitely a warning sign.
Yeah, all of these are so important to notice. And I think I just want to pause and say this: don't sweep something under the rug, right?
Absolutely right. I mean, it's easy to think they're, one of the things we think is, oh, it's just a phase, or if it's a teenager, we can sometimes, we don't always know. It's normally developmentally appropriate to have some irritability, but did your gut tell you it's more than normal, I guess, just that.
I like that, follow your gut. This thought here about warning signs is also helping, I think, viewers to think about, well, how drastic is this warning sign? Is there immediate danger? So here's 4 bullet points here, which all these are important, but I'm wondering, Sandy, so far in your work as a clinician, if you've seen any of these that have been a telltale sign for a client or a family member.
Like the collecting pills, searching for guns, things like that. Family members have said that they have found evidence of that, and some clients will even admit that they've started to do those things. I've heard giving away possessions. I really haven't counseled anyone where that was the case. Just probably the most common I see, especially with the younger population, is concerning posts on social media. That leads one to believe that they're saying goodbye or that they're reaching out, some kind of a cry for help.
That really brings us back to what we were saying earlier. Just a different thought here for parents and friends, whoever. Don't ignore what you see on social media. And parents, I would even add, be looking at your kids' social media.
Absolutely. And I would add to that, even if you see a friend or you see a friend's child that maybe posted something concerning online, do something about it. Reach out to that parent or whoever you can and just mention, I've seen this, it's concerning to me, just wanted you to know, because they may not see it on their own.
Mm-hmm. Yeah, and it feels like, and we're going to talk about support here, but it feels like one of the key things maybe we can encourage everyone about is just take the initiative when you've back to that gut feeling. Mm-hmm. Take the courage to say something and to bring it up. It doesn't mean you're, waving a huge red flag unnecessarily. Just take the risk to say something.
Because you don't want to regret that you didn't and something.
That's right. Else. Yeah. So we want to finish our first part today here by talking about support. And first, as we've just talked about warning signs, statistics, susceptibility. So how do you give support to someone? And these 6 bullet points talk about supporting just day-to-day life. We'll talk about crisis in just a moment. Sandy, as you look at these, what are some important elements from this list?
I would say recognizing that depression is an illness and that it is like a cancer. It's not something they can just get over. I think a lot of people feel dismissed if they do share their feelings of depression. You have no reason to be depressed. Well, that's like saying you have no reason to have cancer. So kind of changing the mentality that depression doesn't care what your life circumstances are like. It can strike anybody. Just listening, being able to listen without fixing. I think, perhaps this is a stereotype, but especially men want to fix things and fix this. They just need somebody to listen, to validate things, and then walk them through those darker days. And if it seems like something beyond something that you can help with, encourage them to go see a professional, perhaps going with them if that's what it takes. But and obviously the removing means from the home. So if you know that they're talking about overdosing, or if that's been a problem in the past, getting those pills out of the house, or at least restricting access to them, removing any guns from the home if that's something that's possibly been an issue in the past or of concern. So just doing the best you can to make it harder to take that step.
Mm-hmm. Yeah, all of those are really good day-to-day thoughts. And here are some thoughts about when you feel like someone actually is really on the edge, how do we support them in crisis? And I really like that first bullet point, back to what we've already said here, but be open and honest. Don't be afraid to ask questions. I know, back to that story I was telling about that one family, I talked to 2 of those family members as their pastor multiple times and was very frank with them. Are you suicidal? Have you thought about this? And where are you? Kind of thing. It at least was good in that moment. They, ended up making the choice they made, but I cannot say that enough. As you look at this list for crisis, Sandy, what do you see here that's you feel it's helpful for people to know?
Yeah, especially like you said, I mean, in counseling for sure, we always ask directly if you're feeling suicidal, but it's something that we never asked our son. And I know that I wish I had. So don't be afraid to ask that question. Sometimes we're afraid the answer is going to be yes. So just things like this, like we're doing today, can maybe prepare you for the yes, if that person is feeling that way.
Mhm.
So just, and giving support and not making them feel like it's something that they should be ashamed of and just try to get over. Some people need help over that hump.
Yeah, and I believe, at least I've read this. You can tell me if I'm right or the myth is real, but I've read that people tend to think that they don't want to bring it up because it might actually encourage the thought and feed it.
Right, and that's a very good point, and the opposite is true. I mean, I think if we ignore it, the person feels even more isolated and misunderstood. So in most cases, bringing it up is a good thing, because then it's kind of like just taking that monkey off the back and getting it out there. And I mean, I counseled people who came in and said that they almost took their lives that morning, and just being able to talk
Mm.
about it, cry about it, and share those feelings, they left feeling lighter. So as long as you're feeling supported when you share those feelings, it can take some of the weight away.
Yeah, and that support, is to bring hope to that person. If they are feeling, like you just said, really alone and isolated, bring them out of that dark place. And maybe you're like, I'm not the professional, I don't know how to do that. That's okay. As we've already noted, encourage them to seek out someone. We wouldn't be doing our job here if we didn't highlight these lifeline numbers that are available to you. You may not be aware of a new number. 988 is a new number that came on this summer, and that's available. It's easier to remember than that 1-800-273-TALK, but they're both available and helpful, and professionals are there. So if you yourself are in crisis, or someone please take advantage of these numbers. There's a text number there as well, and we want to make sure that you're aware of those. Sandy has put together her information today using these references and these resources. So I'm going to leave this up here just for a second for you viewers. If you want to dive in further and look into any of these resources, they are available to you. I don't know, Sandy, did you have a word you wanted to say about any of these references and resources?
I don't know that I have anything specific. I just know that they were very helpful to me as I was putting together the statistics. So if people have any questions about, likelihood or how to support a person, I think some of those resources could be helpful in getting additional information. So.
Yeah, and if nothing else, it gives you some websites that have more information for you, and you can just go explore and see what you find there. That would be helpful. We want to wrap this session today just to let you know, Sandy's one of over 20 clinicians that we have on our staff at Samaritan. And if you're like, I don't know what to do next, whether that's for yourself or for a family member, please reach out to us. If they're in crisis, of course, use those other numbers, but call us and we can get you connected to a counselor. They can meet you in person. They can meet you by telehealth. You can explore our website, SamaritanGulfCoast.com, and learn more about our services, and even initiate a conversation through our website. Whatever means the next step you're ready to take, we're here with you. So we're going to end today's session, and just a reminder that our second part will be this Saturday on September 10th, the actual day for suicide prevention and awareness. So join us on Saturday for part 2. Thanks again, Sandy, for being with us today.
Appreciate you having me, John. Thank you.